Hello everyone, my name is Liu Ruoshi. I'm from the Department of Traditional Chinese Medicine, the first affiliated hospital of China Medical University. I'm the teacher of this class. Today, I'm going to explain the kidney meridian of foot, Shaoyin, in the 12 meridians. This class will explain the related contents of the kidney meridian of foot Shaoyin from 3 aspects. Now, let's start our class. First of all, let's start to learn the course of the meridian. The kidney meridian starts from the inferior aspect of the small toe and runs obliquely towards to the shoal. It comes out from the tuberosity of navicular bone, runs behind the medial malleolus and enters the heel. Then it ascends along the medial side of the leg to the medial side of the popliteal fossa and goes further upward along the posterior middle aspect of the thigh towards the vertebral column, where it enters the kidney, its propending organ, and next with the bladder. The straight portion of meridian re-emerges from the kidney, ascending and passing through liver and the diaphragm. It enters the lung, runs along the throat and terminates at the root of tongue. A branch brings from the lung, joins the heart, and runs into the chest. The course of the meridian has been learned. Next, let's start to learn the principal indications of the kidney meridian of foot Shaoyin. Constipation, disease of the external genitalia, diseases of kidney, lung and throat, and other diseases of regions along the course of this meridian. The first 2 aspects of the kidney meridian of foot Shaoyin have been studied. Now, let's start to learn the third aspect, the points of kidney meridian. This meridian appears at Yongquan and ends at Shufu. Bilaterally, it's consisting of 27 acupuncture points. In this knowledge point, we are going to learn 6 acupoints commonly used. The first point is Yongquan. The acupoint is located in the depression when the foot is in plantar flexion. A proximal toe at the anterior third and the posterior 2/3 of the line from the web between the second and third toes to the back of the heel. The location of this acupoint contains deeper the plantar arterial arch of the anterior tibial artery, the distribution of the second common plantar digital nerve. The acupoint can cure loss of consciousness, sunstroke, infertile convulsion, manic psychosis, epilepsy, headache, dizziness, insomnia, hypoptysis, sore throat, constipation, dysuria, hot sensation in the show. The operation measured of this acupoint is that perpendicular insertion 0.5 to 1 寸. The second point is Taixi. The acupoint is located posterior to the medial malleus in the depression between the tip of the medial malleus and tender calcaneus. The location of this occult point contains the posterior table artery and the vein, the distribution of branch of the table nerve. The occult point can cause headache, dizziness, insomnia, poor memory, spermatoria impotence, swelling and pain of pharynx, toothache, deafness, tinnitus, cough, asthma, hemoptysis, chest pain, diabetes, frequent micturition, constipation, irregular menstruation, lumbar sacral pain, pain and cold sensation of lower extremities. The operation measure of this occult point is that perpendicular insertion 0.5 to 1 寸. The third point is 腹流. The occult point is located 2 寸 directly above 太溪, anterior to tender calcaneus. The location of this occult point contains deeper anteriorly the posterior table artery and the vein, deeper the tibial nerve. The occult point can cause edema, febrile disease without sweat or ceaselessly sweating, abdominal distension, diarrhea, stiffness and pain of back, weakness, numbness and pain of lower extremities. The operation measured of this occult point is that perpendicular insertion 0.6 to 1 寸. The fourth point is 阴骨. The occult point is located when the knee is flexed on the medial side of the popliteal fossa, between the tendons of semitendinous and the semimembranous. The location of this occult point contains the medial superior genicular artery and the vein, the distribution of the medial femoral cutaneous nerve. The occult point can cause manic psychosis, impotence, dysuria, irregular menstruation, metrorrhagia, and metrostaxis, pain in the medial side of the leg and the knee. The operation measured of this occult point is that perpendicular insertion 1 to 1.5 寸. The fifth point is 盲枢. The occult point is located on the middle of the abdomen 0.5 寸, lateral to the center of umbilicus. The location of this occult point contains the muscular branch of the inferior epigastric artery and the vein, the distribution of the branch of the iliac hypergastric nerve. The occult point can cause abdominal pain and distension, constipation, diarrhea, irregular menstruation, hernia. The operation measured of this occult point is that perpendicular insertion 1 to 1.5 寸. The sixth point is 幽门. The occult point is located 6 寸 above the center of the umbilicus, 0.5 寸, lateral to the anterior midline. The location of this occult point contains the superior and the inferior epigastric arteries and the veins, the seventh intercostal nerve. The occult point can cause abdominal pain and distension, vomiting, diarrhea. The operation method of this acupoint is that perpendicular insertion 0.5 to 1 cun. Do not puncture deeply to avoid injuring the liver. Now, the content of the kidney meridian of foot 少阴 is finished. Thank you for watching.